Tenderfoot, Scout Rank Requirement 4A. Show first aid for the following: simple cuts and scrapes, blisters on the hand and foot, minor thermal heat burns or scalds, superficial or first degree, bites or stings of insects and ticks, venomous snakebite, nosebleed, frostbite and sunburn, choking. Minor cuts and scrapes. How to treat them. First, wash with soap and water, then apply antibiotic ointment, and finally dress with a sterile bandage. Clean and rebandage as often as needed. Blisters on the hand and foot. If you can stop the activity, simply clean the area with soap and water and then use moleskin, cutting out an area not to touch the blister, to protect the area. If you must continue the activity, clean the area with soap and water, then use a sterile needle to drain the blister. Apply ointment and cover with moleskin. Minor burns or scalds, first degree, including sunburn. Run the affected area under cold water or apply cool, cold, wet compresses until the pain goes away. Apply aloe vera ointment or burn cream or spray. For sunburn, get the victim out of the sunlight. Have them wear long sleeves and a hat. Insect bites or stings. Spider bites. There are two major American dangerous spiders, the brown recluse and the black widow. The black widow is easy to identify because of its hourglass red markings, but the brown recluse usually is going to be in areas that are dark and cool, dry areas. For most spider bites, treat as a minor cut. Use an ice pack for swelling and watch for signs of shock. Call for emergency services if there is difficulty swallowing, nausea, vomiting, or extreme pain. Always take black widow or brown recluse bites to emergency services. Tick bites. Put on medical gloves. Using tweezers, gently grab the head or as close to the head of the tick as possible and slowly pull the tick out. Treat as a minor cut. Watch for fever, as this could be signs of Rocky Mountain fever. Insect stingers. Use a flat surface like a credit card or pocket knife to push the stinger up and out of the wound. Never grab the stinger or press on it, such as with tweezers. Treat as a minor cut. Watch for signs of swelling, difficulty breathing, and shock. Seek medical treatment immediately if you see any of these. Venomous snakebite. Identify the snake if possible, but be safe. Do not try to catch the snake. Keep the victim calm and remove all jewelry. Keep the bite at or below the level of the heart. Treat as a minor wound. Do not bind or constrict the wound. Get the victim to medical assistance as quickly as possible. Watch and treat for shock. Nosebleed. Sit the victim down and have them lean forward. Do not tip their head back. Have them pinch their nose just below the bone. Apply pressure to the top lip. If needed, hold a cold compress to the area. If the bleeding doesn't stop within 10 minutes, seek medical attention. Frostbite. Identify that it is frostbite, a grayish or white patch of very cold skin. If possible, get the victim out of the cold. Minor frostbite can be treated by placing the affected area of the skin in contact with warm skin. Severe frostbite. Put the victim in warm, dry clothing. Wrap affected areas in dry blankets. If you are sure the victim will not be exposed to refreezing, you may warm the area in warm but not hot water until the color reappears naturally. Use warm, dry, loose bandages. Choking. Immediately have someone call 911. Tell the person affected that you are there to help. If they can cough, talk, or breathe, they are not yet choking. If they are choking, stand behind them. Put your arm under them and around the shoulder to support them. Bend them over and give them 5 quick blows to their back with the palm of your hand. If they still can't breathe, Stand behind them, making a fist with your hand, thumb in, and put your fist over their belly button. Cover your fist with your other hand and thrust it upward at the same time. Repeat 5 times. Repeat the back blows and abdominal thrusts until the victim can breathe or becomes unconscious. If they become unconscious, lower them to the ground and begin rescue breathing until they can breathe on their own or emergency services arrive. This has been Scouter Rob. Like, share, and subscribe if you want more videos like this one.